You're about to discover what doctors really think about the elderly. Those truths whispered in hospital corridors, but never spoken openly. I've been in those rooms. I've seen the medical records. And what I discovered left me speechless. Behind the professional smiles and polite nods lies a very different reality, one that profoundly influences the way the elderly are treated. Every single day. It's not just about medicine. It's about time, profit, and prejudice within a multi-billion-euro healthcare system. I've seen elderly patients dismissed in minutes, labeled as too complicated, uncooperative, or worse, unworthy of commitment. And the most disturbing part? Studies confirm it. Older people receive fewer life-saving interventions, fewer cutting-edge treatments. They're more easily overlooked when symptoms don't fit perfectly. It's not guesswork, it's science hidden in plain sight. Tonight, I'll reveal the 5 inconvenient truths doctors actually believe about older adults. Some will leave you speechless, others will sound painfully familiar. But when we get to number 2, you'll see concrete evidence demonstrating how older people are treated differently in emergencies, a bias so real it can mean the difference between life and death. Don't trust anyone blindly. Before we begin, let me ask you a quick question. How old are you and where are you watching from? Leave your comments. I read them myself, and your stories fuel these videos. Now, without further ado, let's start with number 5. And it's a truth that silently shapes every single doctor visit. Number 5. Older people are seen as too complicated to deal with. Doctors are trained to think quickly, make decisions, and move on to the next patient. But older adults often arrive with multiple conditions at once: high blood pressure, diabetes, arthritis, memory loss, and more. Instead of seeing this as a normal part of aging that deserves careful attention, many doctors silently think, too complicated. Research proves it. A 2018 study in the Journal of General Internal Medicine surveyed 500 doctors. Nearly 60% admitted feeling frustrated or overwhelmed when treating older adults with multiple conditions. That frustration matters because it changes behaviors. Instead of investigating further, doctors opt for quick fixes: another pill, another referral, or the declaration that nothing else can be done. This is called therapeutic nihilism, a fancy term for doctors believing treatment won't help anyway. For an older person, it's like being sidelined. Harold, 74, went to his doctor because of chest tightness and fatigue. He was told it was just stress and to get more rest. Only weeks later did another doctor discover blocked arteries, the kind that can kill. The first doctor saw an elderly man with multiple problems and simply thought it was too complicated to treat aggressively. That decision nearly cost Harold his life. Physiologically, the complexity of older adults is no mystery. The body ages, systems overlap, medications interact in unexpected ways. But instead of patiently addressing this complexity, many doctors cut corners. They skip thorough tests. They avoid risky but effective treatments. They rely on safe drugs that may not actually solve the problem. Over time, these choices lead to worse outcomes, more hospitalizations, and a cycle of decline that could have been slowed or stopped. The numbers are stark. Older adults with 3 or more chronic conditions are twice as likely to have their symptoms misdiagnosed or ignored as middle-aged adults, according to a 2020 report in Age and Aging. This means that the very group that needs the most care often receives the least attention. And the unspoken truth is this: in the eyes of many doctors, an elderly person isn't a puzzle to be solved, but a burdensome file to open. This attitude fuels missed opportunities, avoidable hospitalizations, and premature deaths. But if being seen as too complicated seems cold, the next truth is even harsher. Many doctors view older people as unworthy of the effort. Stay with me, because what's coming is even more shocking. Number 4. Doctors know that many seniors do not follow prescriptions. Here's a number that surprises most people. Over 50% of seniors don't take their medications as prescribed. It comes directly from the American Journal of Geriatric Pharmacotherapy. Doctors know this, and it shapes the way they treat seniors. Instead of assuming cooperation, many silently assume failure. They prescribe medications but expect you to fail. They recommend plans but assume you'll forget, skip them, or resist. And when they think this way, the quality of care received by seniors declines. Medication adherence, which simply means taking medications exactly as directed, is challenging in old age. Pills pile up, side effects clash, memory falters, and costs rise. For a doctor, it can feel like talking to the wind. And when doctors believe you won't follow their instructions, they sometimes prescribe less effective treatments, avoid advanced therapies, or skip serious discussions. The mindset becomes, why bother if you're not going to? Dorothy, 68, received blood pressure medication after a hospital visit. She struggled with the dizziness they caused, so she quietly stopped taking them. At her next checkup, she didn't admit it, fearing a scolding. Her doctor thought the medication wasn't working and doubled the dose. Within weeks, Dorothy fainted in the kitchen, ending up in the emergency room again. The doctor's underlying assumption that she wouldn't follow his instructions, combined with his silence, created a dangerous cycle. Physiologically, skipping prescriptions has clear consequences. Skipping blood pressure medications can lead to sudden spikes. Ignored diabetes medications can cause blood sugar spikes that damage nerves and blood vessels. Forgotten anticoagulants can mean the difference between life and a fatal clot. Yet, instead of addressing the problem with empathy, many doctors become cynical. That cynicism becomes a barrier between older adults and better outcomes. Science confirms this. A 2019 study in JAMA Internal Medicine found that older adults who admitted to non-adherence were 70% more likely to be labeled as uncooperative or difficult in their medical records. That label then influenced how aggressively doctors treated them later. In other words, once you're labeled as someone who doesn't follow prescriptions, your care could be downgraded forever. The inconvenient truth here isn't that older adults struggle with prescriptions. Doctors expect it, and instead of fixing the problem, they lower their standards. That silent, unspoken bias can be deadly. And if you think being seen as uncooperative is serious, wait until you hear what happens when doctors start treating older people as if their pain doesn't even matter. Before continuing, please hit the like button and subscribe. I'd be very grateful, and you'd be a huge help in continuing this project to improve the health of seniors. The most shocking part is yet to come. Don't miss what I'm about to reveal. Number 3. Doctors believe older people are hiding too many symptoms. Imagine this. A 70-year-old woman walks into the doctor's office with a smile, saying she's feeling mostly fine. What she doesn't mention is the tightness in her chest at night, the tingling in her hands, or the dizziness that scares her. Doctors see this pattern all the time, and it's left many with a brutal hypothesis. The elderly are hiding too much. Instead of open books, they're seen as puzzles with half the pieces missing. Science confirms this perception. A 2021 study in the Journal of the American Geriatric Society found that nearly 45% of older patients admitted to holding back symptoms out of fear, embarrassment, or a desire to avoid being a burden. Doctors know this, and it's changing their mindset. They don't always trust what's being said in the room. They suspect there's more lurking beneath the surface. And when suspicion replaces trust, care can become cold. George, 73, occasionally felt short of breath, but never told his doctor. "I don't want to waste his time," he told his daughter. The emergency room later revealed severe heart failure. His silence wasn't laziness. It was fear of being dismissed. But for the doctor, it confirmed the stereotype. Another senior citizen hiding too much until it's too late. Physiologically, hidden symptoms are dangerous because the body is less resilient in old age. A missed mention of blurred vision could be the first sign of diabetes. Not admitting bathroom problems could be the earliest warning sign of prostate cancer. A forgotten note about numb fingers could reveal poor circulation, leading to amputation risk. When older adults don't share, doctors don't act. And when doctors assume that older adults are always hiding something, they sometimes insist less, investigate less, and end up missing the opportunity to prevent catastrophe. The numbers show the cost. Older adults who underreport symptoms are 36% more likely to be hospitalized within a year. According to a 2020 report in Health Services Research, this means that what isn't saved in the office often leads directly to the hospital bed. The uncomfortable truth is that many doctors believe older adults hide too much, and instead of digging deeper with compassion, they often lean toward frustration. That frustration translates into fewer questions, less patience, and missed opportunities for early treatment. And if you think being seen as secretive is a serious matter, the next truth is even more chilling. Some doctors believe that older adults simply no longer value their lives in the same way. Keep watching because number 2 will completely change your perspective on how medical emergencies for seniors really work. Number 2. Doctors worry about time and seniors require more time. The average general practitioner visit in the United States lasts just 18 minutes, according to the Journal of General Internal Medicine. That's the entire time. History, questions, exam, prescriptions, and goodbye. For seniors with multiple conditions, memory problems, and long lists of medications, 18 minutes is never enough. Doctors know this, and many resent it. Silently, they view elderly patients as time sinks. And in a system where time is money, that bias shapes every interaction. The reality is obvious in practice. Older people speak more slowly, remember symptoms in fragments, and often require more clarification. Many carry lists of medications or even bags full of pill bottles. To a doctor in a hurry, this feels like a ticking clock. And instead of slowing down, many speed up, interrupting explanations, rushing diagnoses, or skipping preventative care altogether. Mildred, 76, came into the appointment with swollen ankles and shortness of breath. She wanted to explain everything from her diet to her medications, but was interrupted twice and given a new diuretic pill. 2 months later, she was hospitalized with advanced heart failure. The rushed examination missed the full picture, and the system's time pressure turned her body into collateral damage. Physiologically, older adults need more time because their body's signals overlap. The chest pain could be heart disease, but it could also be lung scarring or even acid reflux. Fatigue could be due to thyroid failure, anemia, or medication side effects. Distinguishing between these requires patience. Without it, doctors opt for superficial solutions, often missing deeper and more deadly causes. The numbers confirm the damage. Older adults seen on shorter visits have a 25% higher rate of misdiagnosis than those with longer appointments, according to a 2019 study in BMJ Quality and Safety. Yet, in the pressure cooker of modern medicine, longer visits are rare luxuries. The inconvenient truth is this: many doctors worry more about their own schedules than about the lives of their seniors. And when time is scarce, it's the elderly patient who pays the price. But as harsh as it sounds, truth number 1 is the most shocking of all. It explains exactly how doctors decide who receives help in life or death emergencies. If you want to know how to protect yourself and your loved ones, stick around until the end. Comment below if you've ever experienced this rush treatment. Number 1. Doctors know that age bias is real. This is the most uncomfortable truth of all. Age bias in medicine isn't just a suspicion. It's proven. It's real. And it kills. The polite word for it is ageism, but stripped of its jargon, it means doctors make different decisions for older patients than for younger ones, even when the symptoms are identical. The data is stark. A 2020 study in The Lancet analyzed emergency care in older adults. It found that patients over 70 with chest pain were 22% less likely to receive life-saving interventions such as stents compared to middle-aged patients with identical symptoms. Another study in JAMA showed that older adults with aggressive cancers were 37% less likely to be offered clinical trials, excluding them from treatments that could extend their lives. Science doesn't lie. Age bias is alive and well in hospitals. Elmer, 79, arrived at the emergency room after fainting. The staff noticed her age before anything else. Instead of rushing her to advanced imaging, they gave her fluids and sent her home. Weeks later, she collapsed again, this time from a massive stroke caused by untreated carotid artery disease. For her family, it was a betrayal. For the hospital, it was just another elderly patient whose decline was expected. Physiologically, age doesn't make treatments less effective. A stent still opens an artery at 75. An anti-clotting drug still works at 80. Radiotherapy still kills cancer cells at 85. But ageist prejudice makes doctors hesitate, delay, or dismiss, as if the years lived make life less worth saving. This silent discrimination means that older people enter hospitals already struggling, even before diagnosis. The uncomfortable truth is that many doctors know this bias exists, and some even admit it shapes their decisions. It's the silent calculation of resources versus rewards, hidden behind words like quality of life or risk of complications. But behind the jargon lies a darker belief that older lives simply matter less. And that's why older people need to be aware, because when you know the truth, you can expect better. Age bias is real, but it shouldn't dictate your future. Now you know what almost no one will admit out loud: the hidden thoughts doctors harbor about older adults. The 5 inconvenient truths aren't rumors. They're real, they're documented, and they affect millions of lives every single day. When you know these prejudices exist, you approach the doctor's office differently. You ask more specific questions. You bring notes, documents, and a witness if necessary. You refuse to be dismissed. You demand the same urgency, the same respect, and the same chance at life that younger patients take for granted. Because science proves one thing beyond any doubt: treatments don't stop working at 60, 70, or 80. What stops working is the system's willingness to offer them, and that's where you have to fight. Every senior who sees this deserves to be listened to, respected, and treated as if their years make them wiser, not weaker. If anything, your age should make doctors fight harder for you, but that only happens when you refuse to stay silent. So here's my challenge to you. Share your story in the comments. What's been your most frustrating or enlightening experience with a doctor after age 60? I read every single comment because your voices matter, and the more we talk, the harder it becomes for the system to ignore us. If this video really hit home for you, hit the like button so more seniors can see it before it's too late. And be sure to subscribe because we're not done. We'll keep pulling back the curtain. The next video will expose even more truths about post-60 health that could save your life. You deserve answers. You deserve respect. And you deserve the chance to live each coming year with strength, dignity, and clarity. Never let anyone, not even a doctor, make you believe otherwise. If you've been through this yourself or have any advice to add, let me know in the comments. Thanks for watching. See you in the next video.